I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host, and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my loves, and welcome back to the Love and Science podcast. Today, I am so excited to have my friend and colleague, Dr. Dona, who is a triple board certified psychiatrist. She not only does adult psychiatry, but she also does child and adolescent psychiatry and is also obesity medicine certified, which is absolutely amazing. And today we're going to have a conversation about, what is reproductive psychiatry, because she does a lot of perinatal psychiatry. Every single day I get questions, both in my clinical practice and my coaching practice, of like, should I stay on this medication? Like, what about my mood disorder? Like, things are getting worse with the infertility journey, like all these sorts of questions. And so that's what I would love to explore with Dr. Dona, is just sort of what is that as a field and how can it up-level the experience of trying to become a pregnant person?
Yeah, well,
Welcome.
thank you so much for having me. I'm so excited to be here too. It's great to be on, and I'm so excited about what we're going to talk about today. And so, what's funny? I know you said triple board certified, then I guess I'm also perinatal mental health certified too. So like
Wow.
the PMHC is like so.
Yeah.
That's where I
Is
have
there
my subspecialty. Yeah,
Is
it's
there
not a
anything
board.
else you'd like
Yeah.
to add to the introduction? So you're in Florida, but you also can see patients via telehealth in New York and is it Pennsylvania? Because you trained in
Yeah.
Pennsylvania? Yeah. Beautiful.
So I am physically based in Florida, but I am able to do virtual or telehealth visits throughout the state of Florida, New York, Pennsylvania, and Washington, D.C.
Amazing.
Yeah.
Amazing. Well, thank you so much for coming. Tell us a little bit about how you found your way to psychiatry and reproductive psychiatry in particular.
Yeah, so definitely. So I always knew I wanted to be a physician growing up. My father is a physician as well. He was a first generation immigrant to the United States. We're Filipino, so he's originally from the Philippines. So I grew up seeing him really caring about his patients, really really advocating for the special for being in medicine in general. So I always knew I wanted to do something in medicine, and at first I was like, oh, maybe neurosurgery, but then when you're 5 and you don't really know what any of that is, you're kind of like, oh, like
Yeah.
that sounds fun. But then when you get older and you're like, okay, neurosurgery is actually several more, like a ton more years of
Yeah.
training, and like it is a whole completely different lifestyle. You're like, okay, well, maybe let's leave the door open to thinking about other things. And
I have a
uh
quick question. Is your
yeah,
father a neurosurgeon or is he a
no,
different? No, what
he's
is
a
what is his area of medicine?
he's a general practitioner, and he actually
Uh-huh.
did pain
Oh,
medicine.
wow. Very cool. Very
Yeah,
cool.
but
So you're
I
like,
guess
no, maybe not neurosurgery, but I still want to be a doctor.
I think it was something in my head where I was like, neurosurgery, that sounds awesome. Like that's totally like, really like it's a boss thing to like say you're a neurosurgeon. And I was always interested in the brain. So like I knew I was interested in the brain and like the intricacies of the brain, but then that was kind of that thought process. But then when I got older, I actually double majored in psychology and biology. So that's where I was introduced to more of the psychology topics, behavioral health in general. And I was like, oh, okay, so this is pretty interesting. But I would say I didn't 100% know I wanted to go into psychiatry until I was actually on my rotations in medical school. And then you know how you get to go through all the different specialties like internal medicine, pediatrics, whatever. So on almost all of my rotations, I would find that I would want to spend more time with the patients, just like getting their
Yeah.
history, knowing their social background, like everything like that. And then everyone else would be like, come on, like, hurry up, we got to go. We got to look at the labs. We got to do this and that. But that was what I was always more interested in. And I was like, okay, well, there's probably reason for that. And then when I actually got onto my psychiatry rotation, I was like, okay, now there's a definite reason why that I'm wanting to do this. And there's actually field that specializes in really getting to know the person on a deeper level and like mental health in general. So it was during my medical rotations what I was like, okay, psychiatry is it. And then I got into residency and it just further solidified it. And then I've always been interested in child adolescence. So then I knew I also wanted to do subspecialty training, and that's why I did my fellowship. So yeah, psychiatry it's never been a regret of mine. It's a field that I highly recommend just because you can do so many different things in psychiatry. Yeah, adults, children, but then from the perinatal mental health perspective, I just knew that women, that there are so many things like hormones, what they go through during pregnancy, post-pregnancy, pre-pregnancy, that can affect themselves, their mental health in so many different ways. And I'll say from a personal like perspective, so I do have a history of like losses and miscarriages. So I also know like innately kind of how difficult infertility and pregnancy issues themselves can be. So it was just something where I was kind of like, hey, this is already a field that I'm really well versed in. Why not expand my knowledge to be able to help, people going through somewhat similar issues, or like even expand beyond it. And that's where my interest in perinatal psychiatry came. And like, yeah, I am a huge advocate for psychiatry as a specialty in general. I've never regretted it and I love doing it.
That's amazing. Thank you so much
Yeah.
for sharing. And I also think when we have a personal story, it just brings our passion to the field in a much more compelling light because, Henry Nouwen, he wrote about like the wounded healer. And so
Mm.
it's like sometimes it's like where we're wounded, like where we can heal the world the most. And I really do see that connection so much. So thank you for sharing in that way. It's amazing. Um, I see people who are trying to get pregnant and also people who have had losses as well. And it can be a very discouraging time. I mean, there was a study that showed that people who have infertility actually have comparable anxiety and depression rates to people with cancer. And
Ugh.
so, I think that one thing I see is that people want to be doing all the things right, so to speak. And they're like, and I have to get off my meds and I have to do all this stuff. But like, most of my clients are female physicians. They already have a lot of life stress. Infertility is another stress. Like, can we talk a little bit about how you help people navigate, like, sort of what meds are safe in pregnancy? Or, I know that safe word is like a little bit out of favor, but like, how do we help people navigate the risks and the benefits? Because there's really no zero risk situation, but we want people to
Yeah.
be sort of living at their best possible capacity.
Yeah, yeah. So definitely. And thank you so much, for what you're doing to help all these people, through their fertility journey. But yeah, it's definitely not easy. And I think either spectrum of it, there's not a no risk situation. And a lot of times people will assume, hey, I'm taking psychiatric medicine. I think that means I would automatically need to come off of it or stop taking it. But that is a false assumption, and that's not true across the board for most psychiatric medicine, just because a lot of studies are actually showing that yeah, risk versus benefits analysis and profile is that if a woman is doing well on psychiatric medicines, again, there are various ones that there are riskier or shouldn't be taken during pregnancy versus others, and that can be a more nuanced discussion. But in general, if it's something that's helping maintain stability for someone's mental health, it's better to just stay on the course and stay on the medicine versus someone decompensating in terms of their mental health, because that will that the studies actually show that those adverse outcomes are potentially worse than other potential outcomes that are not even guaranteed from continuing other psychiatric medicines.
Yeah, so sometimes what you're saying is that sometimes the risk of going off of the medications is greater than staying on the
Than staying,
medications.
yeah. I'm gonna
Yeah.
say honestly, majority of the time it is, because if someone decompensates when they're actively pregnant, it's already harder,
Yeah.
and then you don't want like, you're the reason you'd come off of it is because you're trying to risk like not risk exposure, but then means you'd have to introduce a medicine anyway, or like you'd have to try different medicines, and that is riskier than, hey, someone is kind of doing well, kind of doing stable, let's maintain this, let's continue to monitor them and then
Yeah.
see how it goes. So like it sounds like a lot more chaotic than
Yeah.
just maintaining the course.
It's so interesting. When I was studying for my boards, I came across some data that women who stayed on their antidepressants actually had lower risk of preterm delivery
Hmm.
and better growth of the babies. And so it's interesting, like, sometimes we think about this being kind of like a risk to neutral situation, but perhaps there's even a benefit to staying on, and not just like maternal stability, which cannot be underestimated for sure, but maybe there's even a fetal benefit to staying on some of these medications.
Yeah, 100%. So, I think, well, basically from your boards, but similar data that I've seen is that untreated maternal, like psychiatric illness, is more likely to lead to potential outcomes versus treated, like premature birth and
Yeah.
like low birth weight, all of those things. So it's like we talk risk versus benefits, but it sounds like the benefits of staying on the medicine or taking a medicine if someone has untreated maternal psychiatric illness is going to be higher than alternatively like not taking any
Yeah.
medicine.
I would love to understand the science of that more. I think it's got to deal with like blood flow, right? And like other, I
Hmm.
mean, it's just like so fast, and probably stress is involved and cortisol and all sorts
Cortisol
of things. Like
levels.
we're
Yeah.
such interesting beings, aren't we? In terms of like just, it's just fascinating to study kind of just who we are as humans and brain chemistry. And then sort of adding a pregnancy in there. There's just like so many unanswered questions. It's just fascinating.
And I think it's yeah, definitely fascinating and huge and can be impacted in so many ways. So not only from a neurochemical level, like the neurotransmitters and cortisol and stress and hormones, but also even from a mental health perspective, if someone has untreated mental health, like depression, are they not going to be taking care of themselves? Like, are they not going to take their prenatal vitamins? Are they not going to be providing proper nutrients to their body? Like all of these things
Yeah.
you wouldn't even take into consideration. But when someone has severe depression, like that, that in itself is a huge medical condition that needs to be
Yeah.
addressed. And then if someone is pregnant, on top of that, and actively growing a life, that is a
Yeah.
whole other issue
That's
that can lead to
right.
complications.
Yeah. And I mean, this is like, this also applies to high achieving women. Sometimes depression or anxiety can be very, very paralyzing. I have, when my clients text me, sometimes they're like, my period just came. I'm so distressed. I can't even get out of my car. I know I need to go into work to see my patients, but I just don't know how I can do that. Or if somebody has depression, they're like, I just can't even get off the couch right now. I know there's things I need to do, but I'm just like so paralyzed by these intense emotions. Like I don't know what to do. And so I think it's like, to sort of reduce the stigma and to say, like, this is a brain chemistry issue. It is not for lack of trying. It's not for lack of work ethic, because then it's like the shame spiral and like
Hmm.
the guilt of like, well, I'm trying to bring a life into the world and I can't even get it together. Like all the things I hear that people say to kind of shame themselves. Like there is no shame here. This is about being a human being with brain chemistry. Our brains are trying to keep us safe, and sometimes we need additional supports, both pharmacological and, therapy and coaching, to really navigate these very complex issues.
Yeah, 100%. I 100% agree with what you're saying. And then also there's evolutionary evidence to that too. So our brains are hardwired to think the negative, or to think about all the bad stuff, or to be our own worst critic. And that comes from the protective mechanism of that anxiety originated to be protective, like caveman era, running away from huge beasts to like make sure that humanity still existed, to ensure survival essentially. Right. But then as evolution kind of went on, it manifested in that now we don't need to be fighting animals outside, or digging around for food, like that type of thing. But yeah, anxiety has manifested into, oh, like if I don't do everything right, if I'm, not working at my 100% capacity, this means I'm going to lose it all, or something bad is going to happen. But
Yeah.
that's where it's like tipped over into not actually being protective anymore and harmful. So, when people think this way, it's not because something is wrong with it. And this is where I'm a huge advocate in terms of mental health, like in that I will say it has come a long way, but the stigma is still there. Like, oh, like, because I can't manage this, or because, yeah, like I can't get off the bed, or I'm feeling so down because of these losses, or not being able to get pregnant, something is wrong with me, or I'm weak. And like, honestly, that is not the case. It's just that these are really hard things. And then our brains are just hardwired to automatically try to protect us by thinking the negative, or by thinking, oh, this is what we need to do to be better. But it's now not necessarily better, but like actually harmful to us, in that it's not allowing us to give ourselves some grace and recognize, hey, we're human beings. It's not easy. Having a loss, having infertility, not being able to
Mhm.
get pregnant is incredibly difficult, and it's isolating. And, especially high achieving professionals, women physicians, they can tend to get down on themselves the most, right? Just because it's like, oh,
Yeah.
like I've been able to be successful in so many other areas. And then I will say the fertility journey in general too. There are so many things that are out of people's control that a lot of times when there is that loss of control, it's something that can further contribute to anxiety and depression. And it like
Yeah.
just furthers this whole
I
cycle.
know. I have this theory that stuff related to fertility just like bypasses the frontal cortex and goes like
Mhm.
right to like the fear centers.
Oh,
Um,
100%. Yeah. The
yeah.
amygdala, primitive. Yeah.
Yeah, and just like you, I was like very interested. Like neuroanatomy was like my favorite course in medical school. Like our brains are so fascinating. I was even listening to something yesterday about how Michelangelo would like dissect cadavers to learn,
Mm,
like secretly to, to learn anatomy. And he was like, isn't it interesting how our brains look so similar on the outside, yet we're so different,
different.
like on, which is fascinating. So that's an aside, but I wanted to sort of ask you, so one other additional layer that I see in my patients and my clients who are physicians is they're like, and I'm now even a bad doctor because I'm not as present to my patients. I'm distracted by
Mm.
this fertility journey. I don't have as much to give. I'm distractible. And so then it's like this shame cycle, spiral about like being a bad doctor. And so what would you say to people in that situation who are just like, not only down on themselves because they're not getting pregnant or they're having losses, but then they start to question their capacity, capability, identity as being top-notch physician?
Yeah, so I would say that it is definitely a difficult thing to experience. And I will say, having experienced it myself, I think it's normal to have these thoughts. So, one, it's not atypical, abnormal for someone to have these thoughts of, oh, I'm going through this really difficult thing. How am I going to show up, or how am I going to perform as best as I can in other capacities, like as my role as a doctor and physician? So, one is really normal, but at the same time, too, it is incredibly difficult at the same time. So as much as you are wanting to do all these things, like I think that this is another situation where people just really have to give themselves that grace and just understand, like, hey, um, while it's normal to want to be able to do everything that you have been doing in the past, this is an incredibly hard journey and for someone to go through, whether it is infertility or losses. And if someone needs to, this is where I think it's going to be important to really assess themselves and like, hey, it's actually helpful for me to know that during this journey, I do have my regular job and that I'm able to show up and able to contribute to my patients. Like, if that is something that is helpful for someone,
Right.
hey, 100% go keep doing it. But this is where it's all individualized and that there's no like one size fits all for every person. So if that is something that is going to be supportive of someone's journey when they're navigating these hard issues, go for it. But if on the other hand, someone is noticing, hey, I'm trying as best as I can, but I'm kind of struggling at work. I'm not able to get things done as best as I used to. That is
Mhm.
when, they might need to take into consideration if they are needing extra support, whether that, yeah, is through coaching, behavioral support, therapy, and or medicines. And then understanding at the end of the day, like th- people aren't people aren't infallible. People, as much as people want to be able to do everything and anything, that's just not possible. And it's okay if, say, you do need to take a step back when it comes to work. Like, work will always be there, if you wanting to work more later, or
Mhm.
if you're wanting to work in a different capacity at another time. But just knowing that you and yourself and putting your needs are going to be I'd say the most important thing. And I think that's where it does really involve this individual assessment of what this person is wanting to do and is actually capable of doing, and
Yeah,
then trying to
that's
move
right.
forward.
That makes a lot of sense, and maybe, like, scaling back for a time, I always think, like, we
Yeah.
we put mental health in this other category, and let's be clear, like, infertility is a chronic medical condition, so, like, I always use the analogy with an IVF cycle, like, okay, if you had an appy, you would be out for 2 straight weeks, and nobody would bother you, like, they'd just be
Yeah.
like, "Oh, yeah, she had major surgery and she, like, needs to recover." But like, I think because infertility, it's more insidious. Like, you go to your appointment in the morning, then in going back to work, in between things, you call your REI, you hope you can get in for an appointment, like all those different things. Like, I think that we need to reframe this, that this is like when you have surgery, when you're on crutches, like you need more sleep, you need more bandwidth, you need all those different things. And so, everything in life is sort of looking at like, what chapter is this in my, like if I
Hmm.
had a sick parent, like my life would look different than it does now, like all those different things. Like you said, I think the message is like, how do we give ourselves grace to say, like, what do I need at this point in time? Do I need a half day off, every
Hmm.
week, and just scale back a little bit more administrative time, because this is a major thing in my life. I will tell you, like, thankfully, in my own life, like things are overall going pretty well, but sometimes I have a rough day and I just tell my staff, I don't need to even get into the details. I'm like, I go into the nursing office and I'm like, hey guys, just so you know, it's been a little rough. Like, I might need a little extra support today. Thank you in advance. Or like, I'm really tired. Like, even if I'm tired, like, hey guys, like I didn't sleep well last night. Like, can you like double check a few things for me? And it just, that sort of plays into the humanness of like, I don't have to be at the top of my game all day, every
All
day,
the
and twice
time.
on Sundays. Like, we
Yeah.
have good days, we have bad days, maybe we just got bad news and we need a beat to kind of figure it out. Like, all those things, I think we need to remind that we are humans too. That's one
Hmm.
thing I love about helping physician clients specifically, is that it's like hard to remember that. So we need to give ourselves permission to be fully human and to have that full spectrum of the human experience.
Yeah, 100%. Like feeling like the need of, yeah, especially, yeah, physicians, female physicians wanting to be superheroes and the ability to do it all. But it's not like anyone's getting a medal, right, for that, or working, working
Yeah.
themselves to the bone. So this is where, yeah, I 100% agree with you in that, assessing yourself and giving yourself some grace. And I'll say, like, even honestly, myself too, in that I am someone who is like type A, loves to get things done. But this is where, yeah, so I have been through, so I've had three losses
I'm
already.
sorry.
Yeah, so I mean, obviously very difficult, but I think what actually really helped me with the last loss was just being able to recognize, hey, this is hard. Like, yeah, I work really hard. I work full time. I have my own practice, but it doesn't mean that I have to work myself to the bone right now. Like, how about I do what I need to do to, maintain myself, maintain my life, maintain my practice, but let me just check in with myself to make sure I'm still capable of this, and like knowing that, hey, if I need to take a step back, like just not putting that extra pressure on myself, I think just helped guide it to be like, okay, well, let's see how it goes, taking it day by day. And then I think with that, it allowed me to be able to move forward in a way that the healing was better. Like, it wasn't like, let me try to get 20 more people. Like, it wasn't anything like that, as much as you might want to channel yourself to that. This is where really checking with yourself and your capabilities, and like, no, I'm not feeling good, I'm actually feeling down, like, let me do and this is where, I mean, I think self-care is still important, because I will say a lot of times when it comes to depression and anxiety, the tendency is to want to go to laying on the couch and doing nothing. And this is where, yes, I think people are allowed to process, but also I'm a huge advocate for getting ahead of it. Like, because I describe depression as like a pit, in that it's something
Mhm.
that if you're in it, it's very hard to kind of get out of. So then, with like self-care, like, things that are good for you but also enjoyable for you. So a big thing that I am a huge advocate for, for everyone, but like for mental health, also specifically, is exercise and nutrition. Like, I really got into exercising, like strength training, like kind of weightlifting, and it was something that kind of just helped channel, like, okay, these frustrations and anger, and then I just kind of felt good after. And like, me maintaining that, it just kind of kept like some semblance of my life together. So I think that, yeah, giving yourself some grace, checking in with yourself, doing things that are helping you feel good, knowing that this is a difficult time period, I think can all be supportive for,
That's
someone
right.
going through difficult
That's
time.
amazing. And getting out of our heads. I think so
Yeah.
much of the time we're like in these
Yeah.
rumination loops, and sometimes we can even like, why me, victim mode, like all those things. And we can really like get stuck in that pit. And
Yeah.
anxiety, thinking about that, anxiety, how do you describe that? Like, I have my ideas about it because I struggle with that myself sometimes, but what do you think about anxiety?
Yeah. So, I mean, I feel like a lot of anxiety, a lot of times that I think it manifests in like either the unknown, the unanticipated, or things that are out of your control.
Yeah.
And because I would say, especially people, but like women physicians in general, we want to be able to control things. We want to know what happens next. We want to be able to plan every step out of the way. And when things are kind of awry, that's when we might get a little bit more upset. But then I think that with anxiety, it's just kind of like it can manifest in a lot of ways too, like heart racing, like feeling like you can't breathe, like chest tightness. So like
Yeah.
things that it might not be on a conscious level happening, but I think it can happen to so many people, and not even for, I don't think even someone has to have been diagnosed with anxiety in general to have experienced situations like this. And especially if someone has gone through something as difficult as either losses or infertility, I would say anxiety and or depression would be really normal. But it's definitely something where I think mindset and like, okay, rumination, spiraling, like thinking about all of the things could have done differently or should have done differently. But those are actually cognitive, from a CBT perspective, like cognitive distortions. And that, is this actually helpful for me to think this way, or are there other ways to think it? And this isn't to minimize what anyone else has gone through, but it's just in terms of what is actually going to be helpful or supportive of someone to feel better. So this is where I think definitely processing, like knowing, acknowledging what you're going through, that it's hard, but then, okay, now that I've kind of come to terms with this, what is something that can actually help me from here, either feel better or, be able to do what it is, what I want to do with my life, which is, either focusing on work, focusing on fertility journey or whatnot, and then being able to take appropriate steps from there.
Yeah, that makes so much sense. Thank you for those great ideas. It's so hard when you're in the depths of it to kind of get out of it. And like so much of this is like timing. I actually recorded a podcast yesterday about like when the period doesn't come, because when the period doesn't come, it means the treatment cycle cannot commence. And
Mm,
all these sort of ideas, and thoughts start kind of spiraling. So, trying to figure out how to get people back their power, because when people
yeah.
feel out of control, that's a really crappy feeling. And so it's like, okay, well, what can I control? I can control my thoughts. I can control, I'm going to get up and exercise. Like I can control these different things. And I do
Hmm.
think it's helpful to try and get back. I mean, there's like, it's this combination of like getting back in the driver's seat when possible, and then letting go of those things that are truly outside of our control.
Yeah, yeah. So that is a huge thing. I was just reading a book recently that was talking about it in general happiness in life. So it was talking about happiness being like 50% related to genetics. So like sometimes there's genetic component to depression and anxiety. 10% is related to circumstance, so situations, but then 40% is actually related to mindset, like how you actually
Wow.
think about things, which is a pretty huge number,
Yeah.
right? Like,
That's really interesting. It's really interesting. Wow. And it's also like that, like Brene Brown talks about like state versus trait, and like, are we kind of wired a certain way, or can our mindset shift over time? Like, I mean, for myself personally, I will say like my mindset really has shifted a lot, especially since I've been doing a lot of coaching, myself, is like, I think my mindset is a lot more self-compassionate. Like, I think the theme of this is like giving ourselves grace. Like, I'm a lot less likely to like shame myself, blame myself, go down this sort of spiral, but just to be like, be gentle with myself, be like, you know what? Like, how can I do this differently another time? Not like, or what can I learn from this? Right. I think they're doing a
yeah.
lot better job in schools these days, like growth
Mhm.
mindset and those sorts of things. But my family has like a long history of seasonal affective, disorder. And like we're
Mm.
in the depths of winter in upstate New York here. And the days are short, you got to take what you can get. Even in residency, I bought myself one of those lights
Oh,
because
yeah. Mhm.
I just was really having a hard time with everything. It's like
Yeah.
whatever can help can help. But I think it's a real thing to think about. Okay, like my genes are my genes. That's something I can't change. But like, circumstance may or may not be able to change that. But sort of like, how can I design some mantras that are going to serve me? How can I
Mhm.
sort of be intentional? Like when I start yoga class, it's like, what's your intention for this class? Like, how can we be intentional about how we want to show up, even in the context of something that's very hard? I think that is super interesting. Um, I wanted to ask you, so, we know that infertility and recurrent loss are very hard situations. How does somebody know either when it's a good time to start medication, or whether like a dose adjustment or a medication adjustment is necessary? Because sometimes people are like on an SSRI and then they're like, "Oh my gosh," but then they have like three unsuccessful embryo transfers in a row and like things get harder.
Mhm.
Like, I mean, and I know this is like a nuanced discussion between a person and the particular patient, but like, what is the general framework of like, when do you start to think about putting somebody on a medication, and when do you start to think about changing up the current regimen?
Yeah. I would say that this principle is going to be applicable to basically everyone that I'm considering to take a psychiatric medicine, and that it's actually impacting, like impairing daily
Yeah.
life. Like
Yeah.
can't can't sleep, can't eat, like that feeling hopeless, feeling down, like feeling like they can't live their lives as normally as they used to, like whether it's work or socializing with others, like getting really irritable or really angry at the drop of the hat, like feeling not like themselves. And that so I'm a huge advocate for behavioral interventions first, like but I will never not prescribe medicines if someone hasn't done that. But this is where, hey, I've actually noticed that there are so many aspects of my life that are not as good as they were. I feel like a different person, or like I feel like
Mhm.
I'm a shell of myself, or I'm not able to live my life as best as I could before, or I'm just feeling really down and feeling really low. And it's all the time. It's not just periodic. That is when I would really consider a medicine on top of the behavioral intervention. So that would be like starting a medicine. And I would say similar principle would be applied when it's coming to adjusting the regimen. And then I would say if someone's going through the process and they're taking a medicine, I would see, is there room to go up on
Yeah.
the current regimen, just because they've already been exposed, like the body's adjusted to its side effects, that's kind of a like more mitigated process. But then whether it's going up on that, or if you're going to consider an adjunct medicine, but then say you've reached kind of higher limits of that medicine and it's still not effective, that's when I would consider
Sure.
switching up the regimen.
Do you have some favorites? Like, so say somebody comes to see you and they're trying to get pregnant. Do you have any sort of go-tos? You're like, oh, I really like these medications. Obviously, this is a case-by-case situation, but I know
Yeah.
I have my favorite fertility medicines. I'm just curious, as a
Yeah.
reproductive psychiatrist, what you like to prescribe.
Yeah, so I will say, the most studies are going to be around sertraline or Zoloft specifically. Pretty well tolerated. Has actually been shown to be pretty safe during pregnancy as well. So sertraline is kind of a go-to. Prozac is a go-to as well. A lot of the SSRIs are considered relatively safe or during pregnancy. I'd say the outliers are going to be Paxil, just because it's working on different receptors that make it maybe not so safe during pregnancy. But those are my two go-tos for SRIs in pregnancy in general. But I would also, because I will say a lot of times when someone is coming to see me, they might already be on a psychiatric medicine. So I will say, if someone is on a medicine that isn't safe, sertraline or Prozac, understanding, hey, there are some ones like mood stabilizers, like someone's on Depakote, that's not a medicine that you'd want to be taking during pregnancy. That would have to be adjusted. But I will always advise someone, if they're taking like another medicine, like an SNRI, like a Fexer, okay, wait, need to be watching blood pressure a little bit more or something like that. But I'm less apt to change a medicine if someone's already pregnant, because it means there's already been exposure, right? And they're doing well on
Yeah,
that medicine. So
that makes total
yeah,
sense. And
case by case.
Wellbutrin too. I feel like that's
Oh
a
yeah.
medication that do you like Wellbutrin in general?
Yeah.
Sometimes.
Yeah, I've seen a lot of success with different patients on Wellbutrin, and that is just kind of something where it's kind of like, okay, if someone's already on it, I'm not going, and it's been successful, helpful for them. I'm not going to be like, hey, let's change this right now, just because you change it. Is that going to be helpful? And then the
Right.
baby, like if they're pregnant, baby has already been exposed to the Wellbutrin. All of these
Right.
things are, I think, really important to take into consideration when it's coming to adjusting medicines during pregnancy or
Yeah.
prior. Yeah.
That makes a lot of sense. So it sounds like sort of frequent assessment is helpful, and
Yeah.
understanding sort of like the severity of the symptoms, the frequency of
Hmm.
the symptoms, and sort of how much it's affecting the sort of quality of life. And also if it's starting to sort of flip into you really kind of empowering somebody's day-to-day
Yeah.
functions. Yeah, it makes a lot of sense. Yeah.
Yeah.
I mean, gosh, your patients are so lucky to have you, to think about like all these, like such an open-minded approach, and patient-centered and holistic and behavioral and medications and all those things. Like, I think we need to think more about these things, especially understanding all the complexities of the journey as well. What do you think about ADHD? So that's something where, it's so tricky, because we know that like a lot of professionals, especially doctors and lawyers, like
Mhm,
do
mhm.
have ADHD. I mean, a lot of it's
Yeah,
undiagnosed, but for those who have a diagnosis and are on like medications, I feel like those meds get a really bad rap. What
Yeah.
do you think about people weaning, staying on in general? Obviously, again, I always have this disclaimer. This is a conversation, not medical advice, but like sort
Yeah.
of
Yeah.
your perspective on it.
So I will say that the stimulants are a little bit trickier in that, so the stimulants, like I'd say not as much data as the SSRIs. And this is where I think it comes to assessing the person and the functioning. Because I actually have come across this a lot within my practice in that like someone will be taking an ADHD medicine and then we'll have a discussion about it and then they'll decide to kind of continue it. But then they'll see their OB or something like, oh no, you need to get off of it. And then they'll kind of just get off of their ADHD medicine just because they were told not safe. So I think that it is definitely something where it is like a risk versus benefit. But like if someone's ADHD is so severe, they're getting into car accidents, they're falling asleep at the
Yeah.
wheel. Like it's like super impactful of their lives. I'm going to say that the risks versus benefits analysis of staying on the medicine or even considering like a dose adjustments if they're on a really really high dose, okay, like maybe that's something where we'd consider coming down. But like yeah, if someone's going to be getting in a car accident from not taking the ADHD medicine, I would definitely suggest them maintaining it versus coming off of it or things of that nature. And then there are and this is where, yeah, during pregnancy, you don't want to necessarily be adjusting medicines for like when someone is actively pregnant, because I know there are the non-stimulant medications, but these are also discussions too, like for basically risk versus benefit, like an analysis of like, hey, these are my symptoms. This is kind of what's going on. This is how much my ADHD is impacting my quality of life.
Sure.
And then, trying to make like informed decisions from there. Just because,
Yeah. I
yeah,
mean, what
like,
I'm hearing
yeah.
you say over and over again is it really is a tailored approach, looking at someone's unique situation, their history,
Mhm.
maybe even their family history with these things, and
Yeah.
really trying to understand what's going to be best for each person.
Yeah. Yeah. Because I will say I have approached it differently in a few patients. In that one, yeah, I would have patients who would say, yeah, falling asleep at the wheel, like I can't function on a day to day. And I'm like, oh, yeah, okay, you definitely should stay on their ADHD medicine versus
Right.
other people who are kind of like, I would take it, not all the time, but sometimes to kind of get through the day. Okay, that's maybe a situation where, okay, maybe if you're not wanting to take to continue this medicine during pregnancy, I think that's a discussion that would be potentially okay for you
And
to.
you help people with these. I mean, it sounds like you help people with these very situations day in and
Yeah,
day out.
yeah,
It's
yeah.
amazing. So good. Well, our time is starting to come to a close. I wanted to ask you sort of a lot of this is about giving ourselves grace. And a lot of it too is about taking back our power. So how do you, in your psychiatry practice, how do you help people take back their power?
Yeah, so I help people take back their power by first of all normalizing everything that brought them in to see me in the first place. So a lot of times I'll have someone come in and say, "Oh, like I think there's something wrong with me," like whether they're feeling down or depressed, or like am I just crazy? So like they automatically will isolate or they'll think that something's like innately wrong with them. So I just normalize and say, "Hey, what you're going through, so many people go through, right? Like depression and anxiety is not um an uncommon diagnosis like at all. And I would say, even if people haven't been formally diagnosed with depression or anxiety, people have experienced it themselves at some point or another to varying degrees.
Sure.
So normalizing it. And then second, like knowing that there are things that can be done regarding whatever symptom or mental illness that they're going through, like behavioral interventions, therapy. I'm a huge advocate for cognitive behavioral therapy. But just knowing, hey, this is like, and this is something that you mentioned before, but I'm a huge advocate for it too. And that like a lot of anxiety and a lot of mental health is like, okay, these are factors, these are things that I can't control, but hey, no, there are a lot of things that I can control. So let's try to shift the focus on what I can control in my life.
Mhm.
So um physical activity. So coming from a holistic approach, like I'm all about uh yeah, physical activity, nutrition, like how that is impacting, like how they're sleeping. Like if someone's not sleeping at night, of course, it would make sense that they're like feeling so tired that they can't get out of bed, or like not like feeling so anxious because their brains just aren't functioning properly because they're not fully rested. And also same goes for nutrition. If someone's not eating well, like of course it's going to be able to impact their ability to just navigate their day-to-day lives or whatever life is throwing at them. So I think it's really important to kind of just get back to the basics first. I also run like the regular screening labs too, like because there are medical issues that can contribute to depression, anxiety, mental health, like thyroid, etc. So I like will always do the medical screening, but then get back to the basics. Okay, are these things that can be addressed? Okay, these can be. Let's work on them. Okay, what else can we do? Like, and then just knowing, hey, they have the power, they have control. Hey, also, I know it's not easy. Again, I think the stigma for mental health is still, it's better, but it's still there. But I know it probably wasn't easy for you to schedule the appointment to want to see someone regarding your mental health, but this is actually really hard and it's really huge of you to be able to do so. So you should be proud of yourself to be able to take this step forward, and that these are the tools that we can use to try to help you feeling better from here. And then,
That's amazing.
yeah, then we'll talk about various treatment options from there.
It's so great. I mean, because I think sometimes like people really feel like they're stuck, but like if you really look at the situation, there's usually something that somebody can do to
Mm-hmm.
get themselves on a better track. I mean, the caveat is like when somebody is actively depressed, when somebody is anxious, like sometimes our brains don't work as
It
well
can.
in those
Yeah.
situations. So you need a guide to sort of help to get out of those ruts, whatever they are,
Yeah.
to then get the brain start to think to work better and start to feel better and all those things. So I do think it is becomes a little bit like a vicious cycle, but I think that for somebody like you who has the awareness and the expertise, sort of just looking at the situation and figuring out how to tinker with things in such a way that starts to flow again, people start to feel better, start to have like a glimmer of joy in their days. Like,
Mm-hmm.
for me, my personal situation is that I'm divorced, and never in a million years did I think that I would like share my children. And, I had a therapist once who was like, you know what, on those times when you don't have them, like think about the things that you can do that you couldn't do otherwise. So maybe it's that you like, make yourself a smoothie that's like very elaborate, or like, I know
Mm-hmm.
it sounds kind of crazy, but I think sometimes like it's not even like we have to spend $500 and, and do something extreme or go to like a, tropical vacation. Like sometimes it can be as simple as like, oh, I made myself chia seed pudding and like that makes me
Mm-hmm.
feel like really wonderful. Or, oh, I watched the sunrise today and that was really beautiful. Or like, snow, like it's starting to snow here in Vermont and New York. And so like we had our first snow last week. So I went running in the snowfall, and that was like so beautiful. So sometimes like these little things that can lift our mood that are very inexpensive, but they create a lot of joy. They give us back our agency. And so, I think that's something where I love helping people with that too, is like, okay, what are those things that are accessible to you that are not going to break the bank, that are, maybe something like you might not even be able to do if things are going differently for you on this fertility process, but like, how can we help you take back your power, all the while giving yourself grace for the things that are, sort of hard right now.
Yeah. Yeah.
Sense.
Yeah, I definitely agree with what you're saying, and it's just definitely kind of something that I kind of think about. Like obviously that this is something I do day in and day out, right? Like talking about CBT and like reframing mindset and et cetera. But I think that something that is really helpful for when people are initially either exploring treatment or mental health is like, hey, you're not alone. This is normal. A lot of people kind of feel like you're not crazy, and then there's actually biological like evolutionary like reasons why you automatically go to spiraling rumination, thinking the worst case scenario, thinking worse about yourself. Like it's not anything that's wrong with you, it's just that it's either how you are raised or how you have spent the last 30 years of your life thinking it.
Right.
And this is where,
Right.
okay, now that you're actively seeking help, we can help you reframe your thinking to maybe think in a better way that will actually be supportive or helpful for you moving forward.
That's so amazing. And I think a lot, as I tell my patients, like, let's get your brain chemistry back in
Mm-hmm.
balance. And whether that's through like behavioral modifications or therapy or, pharmacotherapy or whatever it is. Like, for me, that helps just sort of reduce a lot of the stigma is if I think like we all spend time in chemistry labs on our way to being doctors. It's like, oh yeah, like I'm out of balance. The reaction's not going to work. Like, let me get my brain chemistry back where it needs to be. However, I need to do that so that I can start to enjoy my days again and ultimately get where I need to get,
Yeah.
Yeah.
And you'd use an analogy earlier of like kind of surgery and recovery. And then I'll use like an analogy when it comes to like psychiatric medicine. And then again, like stigma is better, but it's still there in that, like, the one I use all the time is like, say someone has diabetes, right? And is dependent on insulin. Would you tell them, hey, you shouldn't be taking insulin anymore because it's a medicine? Like, I think the same principle can be applied to any medication, but psychiatric medicine, in that like these disorders, they're real medical conditions: depression, anxiety, bipolar, whatever, right?
Yeah.
And just because they're seen differently doesn't mean that they're any less debilitating, and that they should be treated in the same way, whether and then with all the treatment options, behavioral interventions, and or medicines.
Yeah, it's so true. And I think like generationally we've gotten a lot better. Like we have a lot more tools than we used to have. Like I have an ancestor on my mother's side who was just like sent to the shore after she had one of her kids. I'm sure it was some sort of postpartum depression, anxiety, something, and I like our brains are just wired to that, in my family. And so with every generation, I think it just gets a little bit better in terms of like, and these are the supports and these are the tools, and maybe expect that you might have problems in this regard. And one thing I'm very grateful to my own mother for is that she very much normalized all of that. Like, postpartum depression, all of that was like, hey, prevention's the best thing, but like our brains are wired towards it. So let's just do the best we can to try and, support as best as possible and reduce. So I'm thankful to strong women, like my mother
Yeah.
and you. And, I think that's what we're also trying to create at Love and Science is this like strong supportive community of people, because I really do believe we're stronger together. Absolutely.
Awesome. And I'm so glad to hear that your family does sound like supportive and like encouraging when it comes to mental health and treatment. So I think I still see like varying degrees of that within my practice. So definitely some more supportive, but definitely some on the alternative side. So something that I'm constantly having to navigate.
Yeah. Yeah. I think it is helpful when you come from a family that sort of is in support of it, because it just reduces the barriers to get what you need.
Definitely. Hmm.
Yeah. Well, amazing. So I would love for my listeners to know where they can find you. So you see patients virtually who are in New
Hmm.
York, Florida, and Pennsylvania.
Hmm.
A
And
lot of people.
Washington, D.C.
And
Yeah.
Washington, D.C. That's great. So
Hmm.
what's the best place for people to learn about you? Like website,
Yeah.
social media, all that stuff.
So our website is my clinic name. So www.donawellnessclinic.com. So one N. So my last name, Dona wellnessclinic.com is our website. So that's the best way to contact. It also has our phone number and our email, but I also have a Facebook page, Instagram page, and I have a YouTube page that I just started within the last few months that has informational videos about psychiatry, medications, behavioral intervention, supplements, all of the like everything mental health and wellness related. I am putting YouTube videos out for to just share the education and knowledge.
That's amazing. Do you ever do ones that are on like preconception?
Yeah, so I think one I was talking about one video I actually have out is about what should you do with your medications once you just find out you're pregnant. Like, so that is like one
Oh
video
yeah,
I
you
already
know
have.
what? Let's do this. Like, let's obviously, your assistant and my wonderful assistant will be in touch, and I would love to put that video in the show notes for the listeners. I think that would
Yeah,
provide a lot of value.
sure, definitely. I'll do we'll be in contact and do that.
Okay, amazing. Well, thank you so much for coming today and sharing all your valuable wisdom and expertise, and also sharing some of your personal story as well. I know that people are going to benefit so much from this conversation.
Thank you so much for having me. It was really great. And yeah, thank you so much for what you're doing as well too. Like I think you're doing incredible work.
Thank you so much. Talk to you soon. Bye.
Bye.
Thank you for listening to the Love and Science podcast. I'm so glad you joined us today. If you found this conversation valuable, if you could please rate, review, and share this podcast with your trusted people, it would mean so much to me. If you want more tools to help you navigate the fertility journey, please book a discovery call with me today. The link is in the show notes. Please do not let infertility have the final word. I'm here to take the burden from you so that you can achieve your goal of building your family. In gratitude, this is Dr. Erica Bove. I'm rooting for you always.